Okay, so today we'll talk about information technology and pathologists, and this will include the digital pathology, which is the most advanced now in pathology, and actually this is the new era, so everything now is going to be transformed into digital pathology. So we need to understand what is the use of information technology in pathology. Okay, this is very important, and if you miss it, actually you will be far behind in comparison with other pathology practice all over the world. So just I need to check that you can hear me quite well. Okay, we are going to improve everything from next week. We'll have a new camera and microphone as well. Just now I'm using the mobile phone, so hopefully this will be okay for you. Let me see if you can hear me quite well and you can see the screen, so I need some feedback. Just let me know if you can hear me quite well and you can see the screen. Okay. This is a very important task today. Okay. From next week, actually in our department, we are going to have everything digital. So there will be no use of microscopes from next week, and we are going to report everything online. So all the slides will be scanned using a high resolution scanner, will be put online, and with all the patient data can be seen. You can see everything about the patient, all the laboratory results, everything about the radiology, everything in one screen. And the other thing, you'll see all the sections of the case. And also if you order anything, like say if you order levels, or if you order immunohistochemical stains, or if you order histochemical stains, all of these will be scanned and added to the case online. Okay, so you can order this online, you can review this online, and the other thing is we will have what's called voice recognition. So I can dictate the report, and the report will be automatically typed. Okay, so no need even for the secretary to type anything for you. You will dictate, you will then amend the report, and eventually you can authorize the report. Okay, so everything will be online from next week in our department. So what is information technology? Okay, and what is the challenge that a pathologist can face when using the information technology? Okay. The first thing is the attitude. Okay, the attitude of the pathologists. Some pathologists do not accept the information technology. They are not happy with it. Okay, so they need always to see the glass slide. They are not happy to see the slide on the computer. They are not actually used to use any information technology. So many of the pathologists, especially pathologists of elder age or whatever, who are not actually used to see like loads of technological stuff, or they are not don't like it. It's not actually a big challenge. You can learn anything, but some stick with what they are used to do for, like, say 20, 30 years. They used to make diagnosis using the glass slides. So it's very hard to convince them to change to digital pathology. Okay, and always remember that there is a human nature of refusing change. Okay, so change actually is not something welcomed by most of the humans. Okay, the other challenge is actually coming from biomedical scientists. Okay, so those who are working in the biomedical system, they have their view that, okay, we can replace the pathologist by technology. Okay, so instead of, like, say for example, if you give one slide to a pathologist and then you give the same slide to another pathologist, you will find different opinions. And say if you ask a pathologist to score, even scoring, like for immunohistochemical stain, you can have someone who say this is 2 plus and another one who says 3 plus. Not just that, but even the same pathologist in different days, if you can give him the same slide, he can give you another result of the scoring. This is a problem, okay? This is a big problem, and we'll discuss this further, okay? So the scientists, or the scientists in general, do not like the inconsistent diagnosis of some pathologists, okay? Like, okay, where this came from? So, say in a field of lymphoma, okay, the consensus in diagnosis of the field of lymphoma is 30% among pathologists. So only 30% can agree with the same diagnosis in a field like lymphoma. That's so strange, okay? The other claim by other clinicians is that pathology is a subjective specialty. What's the meaning of subjective? Subjective means that you have your own opinion and another pathologist will have another opinion. So these opinions may not match. This is the meaning of subjective. And the opposite of that is what's called objective. Okay, so objective means consistent diagnosis. Okay, this is not actually the case in pathology in general. But if you compare this with even other specialties, you will find the same. Everything is subjective in medicine. Okay, you can have the opinion that this patient had advanced heart failure, and another clinician will say no, he's not in advanced heart failure. Okay, so this is actually, or in radiology, someone will say, oh, this is definitely tumor, another one will say, no, I think this is inflammation. So this is subjective. So even this claim is not valid anyway. So this is the background of why IT or information technology is introduced in pathology. Just to know the idea. The idea is the subjectivity of pathology, the inconsistency in diagnosis, okay? And what they want to do is they need to have a machine diagnosis, okay? They need to have this machinery, okay? I will tell you why this is difficult and what are the advantages and disadvantages of information technology or digital pathology, okay? So, see, have a look at this figure. They went to Japan and they asked people, have you ever heard the name of pathologist? Almost 2/3 of the population or the lay people in the street say no, we don't know what's the meaning of a pathologist. Okay, so even in other countries, not just in the developing countries, the name pathologist is not known, okay? And okay, for those who know what pathologist means, even they don't know the duty of pathologist, okay? So only who knows 15%, and the rest don't even know what is the duty of pathologist. So if you talk with anyone in the public, okay, they may not actually understand what is your job. So IT, the general idea, either it can help pathologists, yeah, and this is what we would like to have, but the other idea is some people would like to substitute completely pathologists, okay? So let us take this one first. To help pathologists, yes, it has actually very important role in education, and we'll talk about this. And the most recent now is in diagnosis, and we'll talk about this. Who are against pathologists? They want to substitute some skills of pathologists, either completely. We want, some people need to have pathologist-free environment, so no pathologists at all in the department, and everything is done by machines, okay? And others would like just to replace some skills, okay? And we'll talk about these. So first, which is information technology is actually a helpful tool. It's actually very helpful, and we'll talk about that. It's actually helpful in undergraduate education for students. It's helpful in continuous medical education or continuous professional development of consultants and trainees. And we have something called computer-assisted diagnosis, in which the computer can assess some of the criteria and then will lead you to the final diagnosis in a very accurate way, and we have actually done a big part of this. And telepathology. Tele means like remote pathology, so it means like you can ask another one in another country to help you for diagnosis, okay? Or you can diagnose yourself while you are away from the microscope or the slide itself. So first, how the IT can help in e-learning education. Okay, now everything, as you can see, is e-learning, electronic learning, or online learning. This is now the era of COVID-19, so social distancing and other stuff led to even courses now transformed to be all online. Okay, how the IT can help in this? The first idea was, how can you study? Okay. The conventional study book is to use like Atlas or whatever, theme books, e-study material, either Word on HTML format. But now we are using the actual live, what's called virtual microscopy. Virtual microscopy, in which you can actually see the slide, you can magnify or see details of any part of the slide remotely from any place. This is now the era, which is the virtual microscopy or the e-study using the slide. Okay, so what is the idea of studying, okay, or e-learning? The idea is to have what's called virtual biomedical universities, and so you need to have something like a university or a college that's actually present virtually, تخيلية, virtually. It's not actually present on the on land, but it's actually present online. Okay, so virtual means that you need to have a full university online. You can study everything. You can even interact with teachers or tutors or lecturers online. So see the difference between the old-fashioned learning, which is using microscopes like these, and you have some of the slides broken, some of the slides missing. You can have one section and your colleague have another section that's different, like these. And now this is now prohibited because of the COVID-19. Compare this one with this nice environment where you have like computers. You can have the same section and you, like say, all these students can see the same section at the same time using a single slide. Okay, just to make it easy for you, just like imagine that you have a cytology slide. Cytology slide, you cannot actually have another copy, it's just one copy. Okay, so you cannot give all of these students the same slide. Okay, but with virtual microscopy, if you have this scanned on the computer, all of these students can see the same slide. Okay, and see how neat and nice to even the lecturer or the tutor can see the same image while all the students can see the same and interact, nicely with the tutor or lecturer. How this started, how the virtual microscopy started. Okay, like say in the past. See, this is an old like paper here. This is to show you how things started. There's just an image and some annotation on the image. You can see annotation here, yeah? And just like that, just to show this is a gross or macroscopic examination of the specimen, and it's just marked with these, so no need for anyone to teach you anything, because you can just have a look at the image and you see the annotation, so you actually you learn yourself. This is another very early use of virtual microscopy, to have just a photograph, and the photograph is magnified, and you can have the legend to describe the lesion. This is one of our very early use of virtual microscopy. This was in 2006, and this actually was called self-directed learning package in bladder cancer. We invented the first online virtual microscopy course. Okay, I will show you how actually this was done. So we have done this all online. If you can see here, this is bladder pathology in general. We divided this into 3 levels: level 1, level 2, level 3, and some lectures and other stuff. The level 1 talks about the normal structure, level 2 talks about the inflammatory, and level 3 talks about the precancerous and malignant lesions. Okay, I will show you how we have done this. You can see a video now. So this is level 1, 2, 3. You can see a complete video of this website. So with level 1, you can see all of these here. These are the normal structures, and these are the virtual slides scanned, and you can magnify any of these. This is the level 2, where you can see hyperplasia, you can see inflammation and reactive changes. And then this is the level 3, where you can see the tumors even like staged as T1, T2, etc. Okay. The other resource is where you can see lectures. Okay, you can also see lectures in PowerPoint format, and you can have also urology pictures. This is also the final exam. The final exam was done online. So I'll show you how this can be done online. The exam is done online, and even you get the score online. So have a look now and see. You'll open, this is a case study, and you will be asked some questions. So case 1, for example, this is urine cytology, this is the biopsy, this is the lymph node metastasis, and you'll be asked a question about that. Okay. This is another way of examining, which is multiple choice questions on the virtual slide or on the digital slide. Okay, you'll see now here, this is the slide. You can magnify, and then you see the question here, and you have choices. So this is the question. This is the area of the question. You can magnify it. This is CIS, carcinoma in situ. And you'll be asked a question, what is your answer? And then you click, and you move to the next one. This is a papilloma. Okay, you will be asked what is in this question. So you click on that. This is bilharziosis or schistosomiasis here. You can see the bilharzal ova. You can magnify. Then you answer the question, and then you get your score online. So online you can move actually from one slide to the other. So you have 30 questions, 30 MCQs. These MCQs are all based on a part of the image. Okay, so if we move to the next one, I'll show you another video as well. This was in the University College Dublin. You can see this video. You have all the slides. You can have the clinical history, as you can see here, the case. All of these are for students, yeah? So you have the clinical history, you have everything. Everything is connected with like hyperlink. You click on the hyperlink, and then you will move to see the image, for example. If you want to learn, What's the meaning of calcifications, for example? How they look like? Okay, okay. These are the calcifications in the mammogram. Okay. Now we'll move to another case, and this was for the third year medical students. These are areas where they are all marked here, you can see, and you click on any of these, okay, just to show you this is lobular carcinoma in situ. You can magnify. This is a breast tumor, but this is lobular carcinoma in situ, and with every bit of these you can see the meaning of it. This is apocrine metaplasia. You can see all of that. So every part of the text that has an importance clinically is connected with hyperlink, and the hyperlink is actually connects you to the digital slide. You can see that here. Okay, so have a look. This is a tubular adenoma. So they will magnify to you the areas of dysplasia and other areas, high power architectural features, what makes it high grade dysplasia, what makes it low grade dysplasia, and everything is hyperlinked here with this inset. So you just click and it will take you directly to the area of interest on the digital slide. So in this case, actually, you don't need anyone to teach you. See here the nuclear features and all the comment. Once you have done this, no need actually to teach anyone. This is just self-learning, so the student can go himself and teach himself, okay? And he will be examined on this, as you can see online, okay? So these are examples of self-learning, okay? And this is for students. Okay, so this is the use of we'll talk about the image analysis later on, but now continuous medical education. Okay, this is for trainees and consultants. What is the use of information technology? This is another website, but this is actually for advanced learning, so learning for trainees. Okay, and I'll show you a video as well. So this is like say breast slides, breast cytology, breast histopathology, then you will have cervical cytology. All of these are scanned slides and seen by expert pathologists, annotated as well. You can magnify, you can zoom in and zoom out, and you can even go very close to see even the nuclear features, okay, like in this big tumor here, which is well circumscribed, and you can actually go through all of these, and you will see the diagnosis, you see how the actual report, how it looks like, what are the features of this tumor, and this will stay like that. You can see it at any time, and you can have a look, you can move in the slides, as you can see here, and okay, so this is one way of learning. I'll show you another slide. Let us see this one. This is like also collection by experts. Okay, yeah, I have shared before the collection of Dr. Joan Rosai. These are collections by different specialists, okay? These are for trainees and consultants as well. So they can go through all of this, it's like say breast, gynae, everyone who's expert in his specialty, leaving some slides with comment, and if someone is going for exam or whatever, he can go. So this is GI pathologist seminar, and these are all the cases, okay? So you can go case by case, and every case you have the text related to this case with the diagnosis, with the like diagnostic criteria of such case. So these you will never forget about. Okay, you will go see the digital slide, and you will have the diagnosis in details attached to this slide. Okay? And as you can see, it's very interactive. You can see it at any time. No need for a microscope. You can use it while you are going for exam, or you are going. These are collections as well from different meetings and different conferences. You'll have all of these, and you can even interact with the expert. You can say like, okay, I'm not happy with this diagnosis, or I need much more. You see, you can measure. This is the measurement as well here. You can measure different areas. Yeah. You can take snapshots. You can add annotations. So I would like to write something on the slide, so I can actually write whatever I want, and I will ask about this area. Okay. These are the measurements you can measure, and like say for example, if you're examining for a melanoma or whatever, you can do the measurements actually on the slide. No need to have a graphic view. So virtual histopathology or digital histopathology, now this is the era of histopathology. This is the new advanced techniques. Okay. So and you can see like everyone. Many actually websites starting to have this Pathonet, PathXL, iPath, all of these collecting slides. The third part of information technology used in pathology is something very advanced called computer-assisted diagnosis. Okay, and we have done a work in this, and this was approved by the Royal College of Pathologists. This is called computer-assisted diagnosis, in which the computer itself will help you in the diagnosis. Okay. For that, we have actually done many DVDs and CDs that actually have all of this information. You can just put it in the computer, and it will help you in the diagnosis. Okay, I'll show you how. This is a video to show you. This is just a computer. You have the DVD put in this computer. You open it this way, okay? So you open that, okay? And then what's called in view, okay? This is like say we have breast, we have cervical, we have gynae, different. So you go now, you choose whatever thing you want to see. So this is, for example, cervical biopsies. And then you choose one slide, one of these virtual slides. See here, you can move the cursor. So say I have a slide, and I think it's actually the slide looks like that in the middle, or that on the right hand side. This is regarding nuclear features, okay? Polymorphism, sorry, this is regarding polymorphism, okay? So the slide I have looks like that. So I just move the cursor. Then mitotic activity, okay? The slide looks like this, okay? I have moved actually the cursor. Then nucleoli, do we have nucleoli or not? Okay, so I'll move it. Okay, then loss of polarity, is it like this or that, like this? Okay, then superficial maturation, is it present like this or absent like that? Choleocytic changes, are they look like this or look like that? Okay, you move the cursor, you move it right, left, okay, move it this way or that way. This is chromatin pattern, and then you will get the final diagnosis. Okay, we'll see now your final diagnosis. Okay, you get immediate a PDF that shows you that you choose that this is SIN2. Okay, this is your diagnosis. But, sorry, it's actually SIN2, but your diagnosis is normal. And this is to show you the differences in your interpretation and the expert interpretation. So there we have two graphs. One for your interpretation, and then this will show you as well table, immediate table. This is the expert and this is you, okay? And where you have agreed to each other and when you were over or underestimated. This is called computer-assisted learning. This is actually approved now by the Royal College of Pathologists and UCCAP. And it's the subscription for the license is $1,000. Okay, we have done this since 2006. Now we'll move to another use of IT or information technology, which is the telepathology. Telepathology or telemedicine in general means that you are here in an island, okay? And this is the hospital, and they send you a signal, please, we need you, okay? You have your mobile phone or you have your laptop, and you can actually help them in diagnosis while you are away, okay? This is the idea, the funny idea of telemedicine or telepathology, okay? You can diagnose while you are away, but it's unfortunately you can be nagged and irritated while you are in a holiday, okay? So this is telepathology. Why telepathology is a good idea? Telepathology is the current use of pathology online. You can report online without the use of microscope. You can report anywhere. You can consult anyone in another place. This is telepathology. The use of that, or the urge to use telepathology, is due to increase in the number of biopsies. There is shortage of diagnostic pathologists. This is actually here in the UK, as I said before, only 3% of the hospitals have enough pathologists, okay? So, we need those who are retired, okay, to work. We need those who can work out of hours, okay? So they can use the telepathology, okay? The third urgency to use telepathology is the progress of IT. Actually, the progress of IT make it very easy to use diagnosis online, and not just that, but it's very accurate, and also you can have all the data of the patient in one screen. The fourth is actually the governmental policy. The governmental policy is to save money, to save time, and this is why they want everything to be done in a telepathology. This is just a website that shows you that this can be done, either educational, teleconsultation, so you can consult even for money, okay? You pay the money and you ask for consultation, okay? So they give you the link to the expert, and you pay the money and you get the diagnosis, okay? Also external quality assurance, also help in publication. See, the telepathology is advanced to the degree it's actually being business, okay? This is, for example, the use of telepathology. These are people here in Beijing or in China, and they are consulting other people in actually Japan. This is now easy, okay? But before, you need to send the slides, you need to wait for days, and then you get that. This is one of the early telepathology is where to use machinery microscope, digital microscope. So you can control using this stick here, and you can move it from one side to side. You can control it from remote areas, okay? The use of digital pathology is actually very complex. It's very complex for us to do it ourselves, so we usually need the help of computer science people. It's very complex to use these networks to compress the image and to use high quality image to avoid pixelation of the image and other stuff. You need to have experts. It's complex, but not for us. It's easy for us, but complex for engineers. This is actually, as well as I told you, you can transfer the image. This is the receiver pathologist. This is the sender pathologist, okay, or the sender physician. Sometimes they can ask you for your opinion. We are not happy with the diagnosis. What's your diagnosis? This is the way it can work. And this is like very early use of digital pathology, where you compare the gross with the microscopic image. In the past, the transfer of images were very bad, especially with something like that, frozen section. This is the permanent image. You can see the difference, but actually this is improved. As I said before, you can actually enjoy your holiday, and then you get a request from someone to ask you for consultation, okay? So they will never leave you away while you are in a holiday. This is a big problem. So what are the advantages of telepathology or telecytology? First, which is primary consultation. You can be asked to do reporting as the first pathologist using digital pathology. This is now what's going to happen all over okay? The reporting will be online. Also, you can be asked for a second opinion, okay? So this will make it easy to have access to a digital slide. You can see the whole image. Instead of someone sending you photos, you can have the whole slide or multiple slides, and you can have access to them. You can magnify, zoom in and zoom out. There will be shorter turnaround time for consultation. Yes, instead of sending the slides by post and waiting for this to arrive, then you see the slides. No, this can happen in seconds. Quality control, yes. Quality control, you can say that this section is okay, is good, is scanned very well, etc. For training of cytotechnologists and residents, yes, it's easy to train residents, trainees, young consultants using digital slides. Proficiency testing as well, this is one. Documentation of data, you can have all the document. Testing the adequacy of procedure from remote center. These are all just, okay. Now we'll come to this question. Can the IT or the information technology substitute the pathologist or not? Okay. The answer of that is yes, partially. You can have partial substitution of pathologists, and I will show you this is actually quite dangerous to pathologists, but it's good for the patient. I'll tell you why. Can you do total substitution? Can you have a machine only to diagnose? Like say in clinical pathology or what's called biochemistry or whatever, you can use machines, okay, to analyze. No need to have any human except someone just to press the button for the machine to work. Can you do this or not? They try. They try by what's called pattern recognition. They try to have the computers extract the pattern and give the diagnosis or differential diagnosis. I will show you how this can happen. Image segmentation, I will show an example of that. Imitation of eye movement. They try to mimic the eye movement of the pathologist. And finally, what's called cytology screening, and this is now valid. Okay, what they do, they put the cytology, cervical cytology slides in a machine, and the machine will dot special areas which are suspicious. Okay, so the expert pathologist will only look at these suspicious areas. So these will be extracted by machines now. You should know that they have actually the computer scientists and scientists in general, they have actually done big deal of this, okay? So, why scientists are struggling to substitute a pathologist with a software? They want to substitute a pathologist with a software or with a PC. They say pathologists are always busy and no time for research, okay? So they want, instead of pathologists to do research, they can do this with software. There is what's called inter-observer chain differences. I have talked about this. If you take the same slide to another pathologist, they will have different opinions. Intra-observer differences, the same pathologist, different days, you can give him the same slide, like to ask about scoring, and he can give you different readings. And the fourth, which is they say pathology is subjective, and I have defended this, that actually all the clinical subspecialties are subjective. This is our first paper to use digital pathology in 2004. This is in collaboration with my friend Professor Abdel-Muta'al Foda. And simply, there was nothing called digital pathology at that time. So what we have done is we used the Photoshop software. Like for quantification of liver biopsy fibrosis. So someone who has liver fibrosis and you want to score it, you will find very subjective. Someone will say this is stage 1, stage 2, stage 3. We wanted actually to extract all the fibrous areas. So what we have done, we stained with mesotrichrome, so all the fibrous tissue in liver cirrhosis or liver fibrosis will be blue in color. Then with the use of filters of Photoshop, we extracted the blue color and we measured it. So we have now, instead of having subjective measurements by the eyeballing or only by the eye, we have objective and we have something semi-quantitative instead. This was in 2004 using the, and you can see here the extraction of the fibrous tissue. This is what's called image segmentation, and we have done this with computer science people. We applied this using a very complex software called MATLAB software. Okay, and this was published in the IEE, which is an electronic journal. Okay, and the use of that is we used what's called image segmentation to evaluate the cervical interictal neoplasia, or the CIN. So in this image segmentation, we collect different data, we extract different areas, we put these together, and with sophisticated equation like these here, we can, by the use of this software, to classify CIN into CIN1, CIN2, or CIN3. Okay, and this is the result of image segmentation. As you can see here, small parts of the images are extracted and then put together in order to find out if we can, by the machine, know if we can know if there is CIN1 or CIN2. You can see actually the density of the nuclei here have a pivotal role in knowing whether this is CIN1 or CIN2. I'll show you here how can we store the images. You can see them here. We should have a different server, but I'll show you something else, which is image analysis used in extraction of immunohistochemistry. Okay, so like here, this is nuclear stain, this is methylation, and I'll just take a part of it, and I will click to analyze this area. I need to analyze. By analysis, I need to know the nuclei which takes the highest stain, like say 3+, 2+, 1+, or even negative. Okay, you can see here, I'll use my special algorithm here. I'm pressing the nuclear algorithm. You can see now it will extract all these nuclei in 1 second. Okay, so the darkly stained, very darkly, will be 3+, will be red in color. The orange will be the 2+. The mild stain will be yellow and will be 1+. All the blue are the negative. You can see here. Can you see the change in color in 1 second? And the number of these nuclei in thousands or hundreds, this will be extracted immediately in an Excel sheet. You will see this now. So all of these nuclei will be extracted. Yeah, now we'll request the Excel sheet to go, and I'm going to save it, give it a name. Then you can transfer all of these data into SPSS or in statistics. You can see that. So this can open now. You'll see all the number of 1+, 2+, 3+, and negative nuclei as well, in just one click. Okay, and you can transfer all the data into SPSS and do your stats. So this is a very easy way to do a research. But the most important is that if you repeat these 100 times, it will give you the same result. So it's consistent result. This is completely, this is very accurate if you compare it with the interpretation of a pathologist. So a pathologist will see it. He can give this 1+ one time, 2+, and you know, this can be different from one pathologist to another, and even the same pathologist in different situations. Okay, I'll show you another algorithm here. Okay, have a look. This is cytoplasmic algorithm. So in this case, what I want to do is, membrane. I want to extract the membranous staining only, not all. So this is suitable for HER2, for example, but I'm just trying to show you how the membranes only can be extracted even if you have cytoplasmic staining. I want only the membranes. We'll see how accurate is this software. See, I just extracted the membranous staining. Yeah, all the red are the 3+, all the yellow are 1+, and all the orange are 2+. Okay, so this is very accurate. If you repeat it 100 times, it will give you the same result. Okay, this is another way. I will show you. Okay, I've shown this before, probably. This is the, like if you want to have ER stain, this is endometrial biopsy, and you want to extract the nuclear stains. We have shown this before. And as I told you, you can count all the nuclei in 1 second, okay? I'll just show you this. Okay, so now you have seen the use of digital pathology is actually very useful, as you can see. But the good thing is to be used by pathologists. If you are a pathologist and you want to, instead of replacing you as you just replace part of your skills like that, like say image analysis. This is very accurate, and you can see here how it's extracted immediately and give you accurate result. Again, there is a problem, pathologists and technophobia. Technophobia means some pathologists hate technology, okay, and hate the information technology, but this should not be the case, okay? We should actually accept the change into digital pathology, and we should get use of digital pathology. Now the question which is raised by scientists, will pathologists be completely replaced by technology? I will just show you an image that will show you that this is impossible, okay? See here what happened. This is the same software we have been used. This software failed to count these nuclei. Can you see these? So the software failed actually to count these nuclei, although they are well scanned, okay? So always there should be a need for a pathologist, okay? This is just an example, but there are many other examples. Thank you all. I'll just wait 2 minutes to ask you about questions. If you have any questions about this lecture, I have finished for today. Okay, so if you have any question regarding this lecture. Okay, thank you very much.